Good morning, everybody. My name is Kevin Kramer. I'm the CEO at Modoc Medical Center. I wanted to provide a brief COVID-19 update for our facilities. And I'll start with Skilled Nursing Facility as a follow-up to the video that we released on Monday. At the Skilled Nursing Facility, as of this morning, we have a total of 28 Skilled Nursing Facility residents that have tested positive for COVID-19. Of those 28 residents that have tested positive, 3 are now recovered, and the majority of those residents are still exhibiting very low level of symptoms or are asymptomatic, so that's good news, and we hope that that continues to be the case. That leaves us with 8 negative residents in the skilled nursing facility. We are testing all of our negative residents every 3 days to make sure that we have a very good idea of whether or not the virus is continuing to progress through the facility. And so that will continue throughout the duration of this event at the skilled nursing facility. I have had a few members of my staff test positive for COVID-19 this week. That gives us, with those that have tested positive since the video on Monday, we now have 17 that have tested positive in December and 23 that have tested positive since the beginning of this pandemic back in March. I've had a lot of questions from the community about utilization of COVID-19 positive staff in the skilled nursing facility, and I wanted to provide some clarification on what we are doing so that you all have the information. At this time at the skilled nursing facility, we are utilizing COVID-19 positive staff members that are asymptomatic on the COVID-19 hallway with those residents that have already tested positive for COVID-19. Nobody is being forced to work those shifts. Those that are working those shifts are volunteering to work because they are asymptomatic, and they are following the same protocol as all staff members down there, so they are in full PPE for the duration of their shift at the skilled nursing facility. Guidance by the CDC and other agencies allows us to utilize COVID-19 positive staff in hallways that are filled with COVID-19 positive patients when we are in staff shortage, and we are in staff shortage right now, so that is why that is being done. I wanted to provide a brief update on our hospital as well. We currently have a full hospital. None of those patients, so we have 9 patients on the floor as of this morning. None of those patients are COVID-19 positive. They're just regular inpatients. This is a very busy time of the year on a normal year, and you layer the pandemic into it, it really makes for kind of the perfect storm. And so we do have a full hospital. I wanted you guys to know that. I also, with that, want to take the opportunity to encourage the community to continue to be as safe as possible and continue to help us slow the spread of this virus in our community. And you guys know the things that you can do to help slow the spread of this virus. It's limiting your travel, it's practicing good hand hygiene, wearing a mask when you're out in public spaces, and practicing social distancing. Those few things will help to slow the spread of the virus in the community, which in turn will help us to continue to have the space and the staff that we need to take care of people the way that we need to take care of people in the way that we want to take care of people. I just felt like it was important that you all knew that we were full in the hospital as well. Again, not with COVID-19 positive patients, but with patients that have pneumonia and are dealing with other things that typically present at this time of year. I appreciate any help you can provide to us and the rest of the community in helping to slow the spread of this virus, and we will keep you updated as things progress here as well.